Gynec means feminine, mastia means breast. So gynecomastia is nothing but female-like breast in a man. Yes, all men have breast, but it doesn't grow into large gland like in a woman. So what happens is during teenage, because of the hormonal changes in the body, the breast respond differently and it grows into large gland. So this is not a disease, it is just a cosmetic problem for men and it can be easily corrected by a simple surgery. So there are a few very common questions which patients ask me during consultations, so I will try to answer them. Will there be visible scars after the surgery? No. With cosmetic surgery techniques, the scars can be minimized and can be made well hidden so that it doesn't appear to anyone. Earlier, the scars used to be big, almost half the circle of your areola and sometimes even bigger. But what we do now is liposuction, that is removal of fat through small hole in your armpit which is less than a centimeter, and after that only a small gland remains. To remove the small gland, we keep only 1/4 circle of a cut around the areola and take out the gland. We choose these cuts so that your scars are very small and are well hidden from the common eyes. Is it possible to lose gynecomastia by diet and exercise? No, because the breast gland contains both the gland part and the fat. The gland part has no effect by any diet or exercise whatsoever, and the fat part that is collected within this gland tissue, it is very difficult to lose it, even more difficult than losing your love handles, so you can imagine. So gynecomastia can only be corrected by surgery and there are no other way. Can it come back after the surgery? Generally no. It is very rare for gynecomastia to recur after the surgery. It can happen only if you are taking anabolic steroids for bodybuilding or if you get any drastic hormonal imbalance in your body, which is also extremely rare. The other scenario may be you putting on too much weight after the surgery. So just like fat getting collected in any part of your body, it can get collected in your chest also. So regarding the complications of the surgery, gynecomastia surgery happens between the skin and the muscle. So one thing for sure, there are no major complications pertaining to your general health, or it does not affect any major organ of your body. It is the most commonly performed cosmetic surgery in our practice and it is very safe. Few things can happen in the natural course of healing. That is, after removal of the gland, there will be an empty space between the skin and the muscle. So some body fluid can get collected in this space, or sometimes small bleeding can occur. All of this can be easily handled and it may just add few extra days to your healing, that's it. So is this surgery very much needed? This is the most difficult question for me to answer during consultations. The parents usually ask this. They say in olden days none of this was done and their elders were fine with it. They sometimes even show that they themselves have this problem and they are not bothered about it. This is actually very subjective and this question is best answered by the person who is requesting gynecomastia correction. If you ask them, it is more of a psychological trouble that starts with bullying by friends and family. It lowers their self-confidence in an enormous way. Trust me, I faced it in some other way. The whole body language changes. The shoulders become drooped. They stop wearing their favorite t-shirts. They wear thick jean shirts or double shirts to cover it. They never open shirts in front of their parents or siblings even. They avoid their favorite fitness hobbies like sports or gym, swimming and jogging. They feel like everyone is staring at their chest. I have seen a college student who kept gum tapes on his chest to press the nipple back because he was bullied. During consultation, there were thick gum marks on his chest which were difficult to remove, which meant that those were old marks. Even the parents didn't know about this. As soon as they knew, they brought him for consultation. Another student, a university gold medalist in UG, could not pursue his career further because he was distracted because of this issue. All these patients are very happy and extremely relieved after the gynecomastia correction surgeries. So if gynecomastia is troubling you psychologically and it is affecting your self-confidence, then it is very much needed. Again, it is the decision to be taken by the person himself. So how will the process be? After consultation, you will be asked to do some blood tests and meet an anesthesiologist. The surgery requires general anesthesia, that is putting you to sleep. For this, you have to stay empty stomach for 6 to 8 hours before the surgery. It is a daycare surgery, so you have to come on the morning of the surgery. After anesthesia, liposuction will be done and gland will be removed. Some stitches will be placed. The surgery may take about 1.5 to 2 hours depending on the severity. After the recovery, you will be discharged on the same day evening. You will be asked to take a few medications for 3 to 5 days. The stitches are usually removed on the 7th day. You will be asked to wear a compression jacket for a month or so. This will help in reducing the swelling. You can resume your vehicle driving and cardio workouts after 2 weeks of surgery and your gym activities and weight trainings after 6 weeks of surgery. If you are from a very far place, we can remove the stitches on the next day itself and put glue on it so that we can reduce your frequent travel. Thank you for watching. Hope this video helps. Share it with someone in need. Cosmetic surgeries can make you confident and beautiful. But to maintain it, diet and exercise are very important. So eat healthy, stay fit and take care.